It's not often you see an entire field of medicine change, but that's exactly what's happened. In just the last handful of years, the way we understand and treat a really complex neurological condition has been completely turned on its head. So today, we're going to dive into what is truly a revolutionary new era for managing myasthenia gravis. Okay, so let's just boil this all down to one simple question. What if your body's own defense system, your immune system, got confused and decided to attack the on switch for all of your muscles? That right there is the core problem we're talking about with myasthenia gravis. So a little more officially, myasthenia gravis, or MG for short, is an autoimmune disorder. This means the body's immune system is making these antibodies that go and attack the critical communication point between your nerves and muscles. And the key word here, the one you really need to remember, is fatigable weakness. The weakness gets so much worse with activity, but then it actually gets better with rest. Now, what's so fascinating and frankly so tricky about MG is just how much it can vary. That's why we often call it a neurological chameleon. For one person, it might just be a drooping eyelid or some double vision, but for someone else, it can be severe trouble speaking or swallowing, profound weakness in their arms and legs, or even life-threatening difficulty breathing. This constant fluctuation makes it incredibly hard to pin down and diagnose. For decades, the way we treated this was, well, it was a slow, uncertain game of just waiting and hoping. To really appreciate how dramatic the recent changes have been, let's take a look at the old playbook. And this timeline just perfectly captures the problem, doesn't it? A patient gets diagnosed, they start on steroids. Then, maybe 6 months later, they begin a broad, slow-acting immunosuppressant like azathioprine. But here's the crazy part. They wouldn't even know if that drug was starting to work for another whole year. And it could take 2 full years to see any real effect. All the while, their body, their function, could be getting worse. Well, that waiting game is over. The entire philosophy has shifted to something we call fast to goal. It's no longer about waiting around. It's about being aggressive. It's race against the clock to preserve that connection between nerve and muscle before permanent damage sets in. So this is absolutely crucial. The goal itself has totally changed. We're not just trying to manage symptoms anymore. The target now is what's called minimal manifestation status, or MMS. And what that means is the patient has no real functional limitations from the disease in their daily life, all while being on the lowest possible dose of medication. And the timeline to hit that goal, it's been radically, unbelievably compressed. If a patient isn't getting close to that minimal manifestation status within just 3 to 6 months, we're not waiting anymore. Clinicians are now escalating to these advanced targeted therapies. The days of waiting for years, they're gone. So let's get into the modern toolkit and see how this new philosophy is even possible. Because we have a whole new arsenal of diagnostic tools and therapeutic weapons that let us fight this disease with incredible precision and speed. First up, diagnostics. The old way of doing things involves something called the Tenzolin test, which was pretty risky and is basically obsolete now. Today, the gold standard is highly precise blood work using what are called cell-based assays. I mean, these tests are so sensitive, they've actually cut the number of patients we used to call antibody negative in half. That means we're getting a clear, accurate diagnosis for so many more people. Now, for a lot of patients with the most common type of antibody, something called early surgery is critical. We've learned that removing the thymus gland within the first year of the disease gives them the best possible chance of long-term remission. And check this out. Thanks to minimally invasive robotic surgery, the complication rate has plummeted from over 11% down to just 1.5%. That's a huge leap in safety. Okay, but what happens when a patient is in a real crisis? Well, there are 2 main rescue therapies. And as you can see, the big difference here is speed. Plasma exchange, or PLEX, is the faster option. We're talking improvement in just 2 to 5 days. And that's because it literally filters the harmful antibodies right out of the person's blood. IVIG is another great option, but when you need to get a severe crisis under control fast, PLEX is usually the way to go. But what if you could get the same effect as that heavy-duty plasma exchange, but with just a simple injection? Well, that's the incredible idea behind the first of 2 revolutionary new drug classes, the neonatal Fc receptor antagonists, or FcRn antagonists. So how on earth does this work? It's actually pretty clever. See, our body has this natural recycling system for antibodies, and it's run by the FcRn receptor. These new drugs simply go in and block that receptor. So instead of getting recycled, The bad MG antibodies get sent to the garbage disposal, basically. They get broken down and destroyed. The result? Antibody levels can drop by over 75%, giving patients really fast relief. It's basically a chemical plex. All right, the second new class of drugs is just as smart, but it works in a completely different way. These are called complement inhibitors, or C5 inhibitors. I want you to think of these drugs as molecular firefighters. In myasthenia gravis, the antibodies don't just block things, they also kick off this destructive chain reaction that creates something called the membrane attack complex. And this thing acts like a literal drill, punching holes into the muscle cell. What C5 inhibitors do is they step in and stop that drill from ever forming. They put out the fire, stopping the final destructive step right at the source. So when you start putting all these incredible advances together, the faster diagnostics, the safer surgeries, these brand new targeted drugs, it creates a powerful new standard of care. This is the new reality, and it's pointing us directly toward a future of truly personalized medicine for this disease. And this right here shows you the new streamlined logic. You get a diagnosis, you stabilize the patient. For the most common type, you go for that early surgery. But the absolute game changer is step 3. If that patient isn't near our goal of minimal symptoms within 3 months, we do not wait anymore. We escalate immediately to these amazing targeted biologic drugs. Ultimately, the takeaway from all of this is just so powerful. For people living with myasthenia gravis, the ability to target the specific, unique mechanism of their disease with incredible speed and accuracy has changed everything. Precision medicine isn't something that's on the horizon anymore, it's already here.